Hey everyone, Madonna Guy here from New Leaf Natural Therapies and David Shield Holistic Counsellor. We thought we would do part two, three quick little tips from each of us that we can do to help with post-traumatic stress disorder, anxiety, that sort of thing.
Welcome everyone.
So the first thing that I wanted to mention is the Moro reflex. So we were talking in the last video about the fact that the primitive brain is much more involved before we're 2 years old. There's an exercise you can do that's
before memory.
Yeah,
So
absolutely.
it's working on stuff before. If we
Totally.
can remember back to about 2 or 3 and then
Yes.
blank.
And the logic and creative brain really don't kick in till about 2 years old. And that's when we start laying down memory differently. So the primitive reflex, the Moro reflex, the startle reflex, the asymmetrical tonic neck riding reflexes, there's a whole bunch of primitive reflexes that are really up and running in the first two. It's part of the startle and Moro reflex.
So is that in around 2 years old?
No. This is from birth.
So fight and flight happens.
So, okay, so this thing called a Moro reflex.
We got fight,
flight, freeze, fawn. Yeah. But in birth, if something traumatic happens to Bubby in the womb, or to mother in the womb, or to the family around them in the womb, then basically that baby can be set up for some stress. So there's an exercise called a Moro reflex, and I've got a separate video on this. So if you type in Moro reflex Madonna Guy, you should find it. And I'll try to do another one today as an updated one. But basically, the Moro reflex is designed to help us crawl out of the birth canal.
Oh, right.
So it helps to strengthen our crawling mechanism. So that's our abdominal muscles, our arms, our legs. So we crawl out the birth canal.
So that the Moro reflex thing is down there in between.
It's all over. It's a whole body reflex.
But the thing
it's a whole body reflex.
You stimulate that part.
But as well as the upper. So it's the whole body.
Okay.
So, and because it lives in the unconscious part of the brain, in that lizard brain area, when we do that exercise as an adult or as a kid, what we're doing, because the Moro reflex lives down here, the act of doing the exercise stimulates these neurons.
What's the exercise?
Well, there's an exercise that you can do for the Moro reflex, and I'll do that as part 3. But basically what it does is helps to, it's like an upside down cockroach. So you lie down on your back with your arms and legs all wrapped in, and then you slowly open out your arms and legs for 30 seconds. You hold for about 5 seconds, and then you come back in for about 30 seconds.
I remember
your arms and your legs.
Doing that now. Maybe 20 years ago.
Yeah, it's amazing. So what it ends up doing, every time you're doing it, it's creating new neuronal pathways in your brain. Nice. So we're strengthening the frontal cortex, which is our problem-solving area.
And our self-regulation area.
Amazing. Absolutely, because it really helps to increase. If we've got strong Moro reflexes, we can have more allergies, we can have more PTSD, we can have more anxiety. It can shut down our immune system. So, absolutely.
So neurodiversity is influenced by that?
100%. That wasn't a term when I learned it, but absolutely. No, so yeah, the Moro reflex is amazing. So that's my first tip. What's a good tip from you?
Bad anxiety. Well, sometimes I see people with nightmares, and because I've spent a lot of time listening to veteran interviews. Like while I was processing my own stuff, the way I switch off would be listening to veterans. And what's interesting about veterans is that they usually have stronger PTSD markers than most people, right? And so they've worked out over the years things there's a whole bunch of different things that are good for nightmares. And one of the good ones is it's a journaling technique. There's a lot of data on it. And it's getting the nightmare and rewriting the ending in a more positive way.
Right.
And so you do that. So there's a few things that there's like nightmare journals. You can get them and you just fill out. They're quite easy to find online. And you can just write when you went to sleep, when you woke up, did a nightmare occur, how many times a night you wake. And just by recording that, you're making more the unconscious conscious.
Yes.
And in psychology and counselling, we're always getting this goal of making the unconscious conscious. It's one of the primary things for everything. So just by noting them down, you end up like making that more conscious instead of just, oh, this happens. Because when you're not sleeping well, you can be pretty confused about everything. Yeah. And so it's like, and by writing it down and keeping a record, it actually tables it. And just that thing they say reduces it, and especially if you do it with some other improving practices,
Yeah.
mindful practices or grounding practices.
And I'd like to, can I add to that?
Mhm.
So I'll have this as my second little tip,
Mhm.
is that visualization, which is exactly where David's going with this, the brain doesn't know what's real and imagined.
Right.
So if we imagine the better ending to the nightmare where we're more in control, or we bring in our guardian angel, or we sort of have a favorite grandmother that we just sort of have in there in the moment to sort of protect, because those sort of things, you sort of think, okay, who are my people? Who are my people? Who are my supportive people? Have them in the nightmare, watching on, making sure that so by visualizing and empowering ourselves in the same situation, it can actually support our because our brain doesn't know. Our brain doesn't know what's real and imagined. So if we're imagining the best outcome, our brain will start to believe it.
Right, because that's another interesting way of doing things. Because another thing is that in those situations, you can really become very what is it when you're overthinking?
Oh yeah, absolutely. A bit obsessive about it.
Yeah.
Yeah.
And so another way to alleviate that is to like writing down the ending. Sorry, I forgot what it was like.
The brain doesn't know what's real or imagined.
Right. And so, there's a technique that people use, and it's called attribution. And so basically it's that.
I think most people use retribution.
Retribution.
Attribution. Okay.
Yeah, so
sounds better.
The way we attribute is really important. So one way to work with that overthinking, and I can't remember the term when you get really obsessed, I get sometimes, and it just doesn't turn off. But what's happening is a way we can look at things is an experience happens and that feels like something, right? That's in reality, but then our mind it makes an attribution.
Right.
Like just say you're driving on the road and there's someone pulls out in front of you.
Turds.
So that's what it is.
Yeah.
It's that negative attribution, and that causes anxiety.
Right.
The attribution itself. Whereas if you just try to be more, so if you reassessing old memories too, it can be that we've gone through something and we've made these negative attributions.
Yeah. And
if we just feel the experience and what it felt like, it's actually not as anxiety causing at all.
Right.
And it's getting into our habits of that idiot. Do you know what I mean? It's like, that's a good one because that's a really fast one.
Yeah.
You're driving, that.
I had a client who was trying to get out of the habit of it. So what she would do every time anyone came in front of her or was an idiot on the road, she'd go, "Thank you very much." So trying to keep it positive, which
positive attributing is a really good one. And the example they use in that is that you send someone an email or a text and they don't get back to you.
Yes.
And what starts happening? Like in cognitive behavioral ideas, I'm catastrophizing, they don't like me anymore, there's all of this stuff. And there are all these attributions where the correct attribution in most cases is they're just busy.
Yeah.
Right?
Yeah.
And so that's even in
or they don't have an answer for whatever it is.
Right.
Yeah.
But nearly always, because I test this out and in counselling we do supervision, and I was saying my supervision advisor brought up this thing. I can't remember the guy who invented it. He's got a TED talk. And she goes, and I go, oh, I do that all the time. Like if I write to someone and I'm like, oh, and I get really, and I told her I was about 90% wrong in my attributions. If I write to someone, they don't get back.
Yeah.
And she goes, oh, it's good you're checking. And I'm like, well, it's like pretty bad.
Yeah.
And but she taught us how to you just don't attribute like that. And so that's one way to help with things if you've got anxiety and trying to stop that circular thinking. That's what it's called.
Yeah, right. Nice. So I suppose my third tip would be journaling, which you sort of touched on, but they actually did a study on the gratitude journaling. And what they found was that when people do 30 days of gratitude journaling each night before bed, they were happier for 6 months afterwards.
Right.
So the act of finding something to be grateful for every day, because our brain, well, maybe ADHD brains are different, but certainly when I've done gratitude journaling in the past, I don't want to write the same thing every day.
Right.
So I could always write, I'm grateful for my hubby, I'm grateful for my family, but after 3 days, you want to find something different. So what ends up happening is that the brain starts opening up to what else could possibly be going on. So we start paying attention to the flowers, we start paying attention to the beautiful blue sky, we start paying attention to the dew that's on the flowers when you're walking on the street in the morning. So you start paying attention to things.
Right.
And when your brain starts to remember the things that we paid attention to, it starts changing the habit of the brain.
Mm-hmm. And but one difficulty with gratituding is that when you're in pain, it's very hard to be positive.
Absolutely. That's
And-
why, and they might have to write down the same things 10 days in a row.
Mm-hmm.
But it is interesting because when they start doing it, absolutely. So what pain does is shuts down the frontal cortex.
Yeah.
So because the frontal cortex isn't up and running, you're not seeing the good stuff.
In other words, everything through your midbrain,
Yeah.
through the limbic system, the what do they call those?
It's coloured. It's coloured with the pain, punishment, fight, flight, freeze stuff.
Mm.
Yeah.
And that's stored in your body. That's the difficult part. It's actually in your body,
Yeah.
the distress.
Yeah, and
And so-
in the way that happens, sort of every cell membrane's got up to 500,000 receptor sites, and those receptors are for everything. They're for magnesium and iron and potassium and zinc, but they're also for dopamine or serotonin or adrenaline, noradrenaline, acetylcholine. So your cells will change depending on what messages you're giving them, because it's easier for your cells to, if we're stressed all the time, it's easier for the cells to make a whole bunch of stress receptors and keep them chock-a-block all the time than it is to release them, detox, make new ones next time we're stressed. So it means we're constantly in this state of expectation of the next stress to come along from a neuroreceptor perspective.
Right, which is living in fight and flight.
Absolutely. So from a naturopathic perspective, when healing sucks sometimes, because if you're cleansing those cell receptors, or if you're doing meditation, or if you're doing journaling, or if you're doing some time therapy, or if you're doing holistic counseling, you're going to be activating some other stuff in the brain, which needs to be cleansed. You'll be cleansing those cell receptors accidentally by doing this process.
Right.
Which is really cool, which is why when we're doing any form of healing, we need to drink plenty of fluids and have lots of herbal teas and, keep our diet nice and clean and cut down on the sugar and the stuff that can activate all our stress receptors.
Which is really hard when you're using those things as comfort.
Absolutely.
When you don't have any other tools available.
Yeah, but that's our job to give people.
I know,
tools.
but the thing is, people often have a limited amount of tools.
Yeah.
And so, I like to say to all the people who come and see me, well, look up online and look for nightmare journals, or if you're having those difficulties, look up online and look at vagus nerve toning.
Yeah. Oh, can I give my other tip about the vagus nerve?
And the other thing is, there's a process for reducing nightmares about journaling where you rewrite the positive story.
Yes.
And if you're having other dream or even if you're having sleep discomfort, there's a journaling method where as soon as you wake up, you just write down what happened.
Right.
And it only takes a few minutes in the morning, but as soon as you wake up, just write down what happened.
Yeah.
And it's all about making the unconscious become more conscious. Once it's conscious, you can deal with it.
We're so not good at giving quick tips, are we?
Right.
So my last tip, and then
I'm used to watching long form
yes,
podcasts that go for 3 hours, and you watch the whole person.
totally. So there's a really cool tip that activates the vagus nerve. So one of the things you do, you get your shoulders relaxed, and you look left and right, and you feel the tension in your neck.
Mm-hmm. There it is.
And then move your head to one side and unfurl the opposite ear. It's usually easier to unfurl the opposite ear. And then get closer. This is why it's good to do it yourself, because it's no, one side at a time. One side at a time. Do the whole thing. And then basically even get inside the ear and wiggle that around and behind the ear as well. And then do the opposite ear. And what you will find by the time that you have done both ears, without a doubt, your ear will feel less tight. Oh, not your ear, sorry. Your neck will feel less tight. So have a feel of your neck. Isn't that ridiculous?
Does that relate to the vagal nerve?
That also activates the vagus nerve,
Right.
because there's receptors on the inside of the ears.
Okay.
So that's a cool
reason,
vagus
and the
nerve.
reason to bring up the vagus nerve is because really, in the last 10 or 15 years, they've found that a disordered vagal nerve system is how the body, like Bessel van der Kolk wrote the book Body Keeps the Score, but a lot of that's stored in the vagus nerve. So if you look at information on how to, they call it vagal nerve toning, or how to calm it down, you'll see a whole bunch of tools there, like particular breathing, particular types of meditation,
Absolutely.
and that sort of thing, to actually get that thing calmed down, because it's actually stored in the body.
And can I mention the medical procedure that people have had in the last 3 years? So there was a research paper put out by Dr. Stephanie Seneff and Peter McCullough about 2 years ago now. And basically what they were finding was that the spike proteins had the ability to attach to the vagal nerve.
Oh, did they?
Yeah, so about 2 years ago, there's a full,
Oh, really?
It's like a 2.5 hour video with Dr. Joseph.
So that'll be like a nervous system damage.
Absolutely. So then, and it's sort of what they were finding was that different nerves were more, because the vagus nerve is so huge,
Yeah,
and
well,
you know,
it's
the biggest nerve in the body.
Yeah.
So because it's the biggest nerve in the body, but it depended on where that was cross connecting to. So some people that might cross connect to the auditory nerves and people would lose their hearing.
It's like
To other people,
it's like an octopus that actually goes around
Yeah.
all the organs to the bottom.
To other people, it might go into the optic nerve and destroy their eyesight. To other people, it might go into the vestibular system and mess with their balance, so that they're unable to walk. And, we've seen so much damage of people's nervous systems.
What's interesting about that, I've been poisoned a couple of times in my life, but I used to work in importers. I got methyl bromide poisoning, and I also got poisoned by somebody poisoned a tree in our yard, and I got really sick from it. And what I thought was interesting is that what I saw with some of the injuries people were having, that it was really similar to being poisoned.
Yeah.
And which is nerve damage. And in all the safety data, at least with poisoning, you can find out what the symptoms are caused by.
Yeah.
They've done. And so you know that, oh, my nervous system's damaged, and therefore you end up with some psychological things that take a while to. And so I've seen all of those things in people who are damaged by this, whether it was by the COVID disease or by injuries, because I know quite a few people with pretty serious vaccine injuries, sadly. But they seemed like nervous system damage.
Yeah, totally.
It's really similar to being poisoned, sadly.
Yeah.
Yeah,
and of course, that study came out last September 2023 that looked at 1,000 people in Japan. There were 700 who had had 2 Pfizers and 300 people who had had none. So it was literally comparing 2 jabs to 0. And the people on average, the 700 who had had the 2, their hearts were working 49% harder than those who had not. So that was just 700 people with only 2. So we know that people's hearts are working harder. We know that people
working harder means it's like having
harder.
Like having ADHD. It takes you 4 times as long to do something.
And here in Australia, our doctors were being told to put everything down to anxiety. So unfortunately, yeah. So unfortunately, because
really, okay.
So unfortunately, because these people are then being sent home, told there's nothing wrong, having lots of tests, and saying, well, it's just anxiety, go home and take your medications. Once again, we're being blindsided and gaslit, which is just awful, because once again, people know their bodies. People know their bodies.
Yeah, but there's enough. Like the studies came out, 1 in 800 people ended up with a serious injury. And that's not enough to see in your close circle, because 800 is like a shopping centre full of people.
Yeah.
And so it's like you don't see that many. It's not obvious.
No, that's right.
But it's
and with our 10% excess deaths here in Australia, unfortunately, if we're the average person, you might see 1 death every 3 years.
Yeah, it's not something
so it's so because I'm in healthcare, I'm seeing it a lot, and because I'm aware and I'm allowing people to discuss this, because a lot of doctors don't allow people to discuss it.
Well, if we go back to the post-traumatic stress disorder, it's witnessing trauma.
Yeah.
Right, that can be a precursor for the symptoms, or even learning about the trauma.
Yeah.
So the people on the front line with this, they're very vulnerable to getting some post-traumatic stress disorder symptoms because it's like serious injury. It looks like that's what happened to people.
Yeah.
They call it serious injury in the study, and the PTSD thing says threatened serious injury. So
Yeah. Anyway,
language,
did we give our 3 tips each?
3 tips.
I think we did. Yeah, so motor reflex, journaling, visualization,
Diary.
That's
and,
feeling good.
And look up polyvagal toning.
Yeah, nice.
Because all of those things that help the body regulate, they found yoga for post-traumatic stress disorder really effective too.
Yeah, beautiful. Okay, everyone. Thanks again.
Thank you.
Bye.